right, so we are going to look at how to measure lower back function today. This is probably the trickiest thing that we do at the office. So what we're going to do here, we have May here in a quadruped position. So it's like she's crawling, right? So she's on her hands and knees. And what we need her to do is we need her to squeeze her butt muscles and her abs to arch her back up as best she can. This is going to see if these muscles are healthy or not by do they have the ability to stretch out. So what we do while she's in this position, as we go down here, we're looking for what's known as the PSIS. It's like kind of the bump at the right where your SI joint is. It's right where the sacrum and the rest of your pelvis come together. At the base of your spine, we try to find that. And then we go down and figure out, okay, this right here is a little soft, and then we go right here, that's hard, right? So that's telling me that this spot right here is the base of her spine. And I've got a ruler pencil. Each vertebra is about 1.25 inches tall. So I made a little mark here earlier with a grease pen, and I just put it at the end. And what I do is I teeter-totter to see if we have good function. It should be looking like a nice arc, kind of like this. So we're going to go up from the bottom and see how each of them are going. So if it's nice and has lots of motion like this, we give it the score of 2. If it's just kind of sitting there flat, it's a 1. And if it's got a scoop, almost like she's not arching up at all, that would be a 0. That would be a segment that's not moving at all. So she'd be a 2, another 2, and then we'd have here, this might be a 1, that might be a 2 and a 1. So it appears that the bottom 2 vertebrae are working really well. Then we get to L3, and that's maybe a little flat. Then we have a little bit of flexion right here at L2, and then L1 is once again kind of flat. And so we take that 2, 2, 1, 2, 1, that gets us to 8, multiply that by 10, and there you're at, 80% function. Now determining what's causing this is going to require us to palpate these muscles. When she's up, you could have either muscle tension, which is telling us there's some sort of problem going on and their body's trying to protect it, or maybe it's something where you feel some areas are soft and some areas are firm, at which point that's adhesion, limiting the range of motion, causing some of that restriction. So that's how it's done.